Thank you, everyone, so much for joining me for this episode of Compassion and Courage, Conversations with Healthcare Leaders. I'm Marcus Engel, and today I have an amazing opportunity to interview someone who is a true hero of mine, Dr. Jean Watson, who I explained a few days ago, Jean, whenever I told people that I would be interviewing you, that other than Florence Nightingale, you are the rock star of nursing. And so that's how I like to introduce Jean Watson, as the rock star of nursing. Thank you so much for being with me.
Oh, my goodness. My honor and delight. I'm so privileged to be with you. And I love what you're doing these days, Mark. It's wonderful.
Thank you. And we're going to get into your work and being able to expose so many more people to how big of an impact you have made in the profession of nursing, which has, of course, saved countless lives like my own. But today, I'd like to start with helping our listening audience get to know who Dr. Watson is as a person. So one of the assignments that I give to my first year pre-meds is to write about an instance where they were there for someone else, or that someone has been there for them. And I'd like to pose you with that same question today. Could you help us understand who you are as a human being by sharing an experience where you were there for someone else, or someone has been there for you?
Well, thank you. That's a very inviting question. And what comes to my mind is this whole notion of the unknowns. Like, we never know how we're touching the life of another person, and they never know how we're being touched. So when we touch someone else, we're also being touched. And I think it's that mystery of unknowns that kind of intrigues me, to make me pause in the midst of relationships and moments. And part of the essence of my work is about these caring moments and how we may or may not touch the life of another person in a way that can be helpful and opening up to their own healing possibilities, or we shut down their access to their own self and what they need. So I have so many moments that it's hard for me to come up with one moment. But I would say, and this gets dramatic, it's more about a moment of death. Because of this last year, I have been here in Mexico, and my partner, who's been with me for 13 years, traveling all over the world, he died suddenly, and I discovered his body here in Mexico. And, you know, as difficult as that is, it felt like a gift. Like, it felt like a gift of a holy, sacred experience to be able to be there. And at the last, his brother told me that one of the last words he said when he talked to him on the phone the night before he died was, "I'm waiting for Jean." And so in some ways, I felt like he waited for me to arrive to give him permission to die, although he wasn't ill. Nobody expected him to die. It was very sudden. So, it's a distortion of your question in a way, but it's also the sacred circle of life and death, that we're all in this together, in this sacred journey. And so to be there for another person at death, or for them to be there for me to teach me something about death, was an equally reciprocal experience. So I think that's a very beautiful, sacred, really holy moment for me. So thank you.
Yes, and thank you. I'm so sorry to hear that. I did not know that. How long ago was his passing?
Just June a year ago.
June a year ago. I'm so sorry. And thank you for sharing that. Those moments of birth and death are the sacred moments of our life, and the in-between moments where people can be there for us. That's really what we get at the heart of your work. So can we go back to your beginning and tell us how you became the rock star of nursing?
Well, my my background is inside nursing. And so I've always been interested in people rather than in pathology, so to speak. So even in when I got my master's in mental health and nursing, it was more mental health and understanding human behavior and health and illness that intrigued me rather than the pathology, psychiatric conditions. And from there, after my PhD and studying philosophy and so forth, I joined the faculty at the University of Colorado, and I was kind of disappointed because everybody was advancing nursing under medical science. And I was asking myself a question: why are we in the university? That medical science is not our model of science. There's no meaningful philosophical foundation for what we offer under medical science. So that was the beginning of my first book, was called Nursing, the Philosophy and Science of Caring. And I did it as a counterpoint to curing science, that we need both and we were all under one model of medical technical cure kind of a focus. So that was the beginning of my career. And from then, I've always been critiquing language and the mindset of the dominant paradigm that that objectifies the human, and adamantly resisting anything that reduces another human being to the moral status of an object, which is what we do all the time, because in the first instance, we have person becomes a patient, and then patient becomes body physical. Body physical gets to be machine or technology. And then when you have that scenario, we've taken a whole human being and we've reduced them down to the moral status of an object. And it's ethically really a problem if we aren't able to critique it, because when you are reducing another person to the moral status of object, you can begin to justify doing something to them as an object that you would never do to them as a fully functioning person. And you honoring the whole person and the whole mind, body, spirit, oneness of being, and never know how you're touching, the subjective world of another human being. And that's the piece that is so missing. We objectify it all. And then we have this empirical science model, which we need, of course, but to use empirical evidence is only one form of evidence. And so we have all these other dimensions of our reality and our context and our relationships, our meaning and purpose that is going on within this context that has to be accommodated. And that's what nursing offers. We have a whole person, whole system kind of phenomena and a worldview. And more recently, my work has taken on a whole new level of, one, acknowledging, and I've written a couple of books now on caring science as sacred science. Well, why is it sacred, you might ask? Well, it's sacred because we're dealing with mystery. We're dealing with unknowns. We're dealing with the life force. We're dealing with the soul of another person. And again, we never know how we're touching that person. And it can be for better or for worse. And more recently, I've been working with the philosophy of Emmanuel Levinas, who's a French philosopher. He's no longer living, but he's a lot of influence with other disciplines. And he says the first principle of science is the ethic of belonging. He says we all belong to this infinite field of universal love, and that's that sacred circle. We all come from this field. We all return to this field. And so we honor this whole cycle of life and death. And the ethic of belonging is really the starting point for a science of caring science. So that differentiates medical science from nursing, from caring science.
And so let's go. Can we go back to your first book? Can we talk about that and then bring it back to Levinas?
Sure.
So let's start with the philosophy that guided your first book.
Well, my philosophy was really based upon critiquing and my attempt to find a meaningful philosophical foundation for nursing that was based on human caring. And so I came up with what I called, well, now have been referred to as universals of human caring. But I was asking myself this very provocative question because I wasn't sure I was going to stay in nursing. I kept saying to myself, is there anything that's absolute core to what nursing is about and what nursing stands for that transcends medical diagnosis and treatment, setting, hospitalization, age? Is there anything that's essentially a core of what is absolutely there that nursing has to offer? And that's that philosophical, ethical, value-based of our core values of universals of human caring. And so from that, then I came up with these 10, what I called curative factors. And I named them, I made up the word because I wanted to be a contrast with curative, a balancing. I wanted to balance and mediate between curing and caring. So we had the 10 curative factors, and then you have all these curing factors. So that was the starting point of my original work. And then as I evolved, I actually renamed those curative factors, and I renamed them as the 10 caritas processes. And now I use the word caritas very systematically and very intentionally because caring has become a slogan. It's just trivialized. Everybody's caring, but it doesn't mean anything. It's been a commodity that hospitals often use just for marketing and so forth. So I wanted to give a deeper ethical value-based meaning of what caring means in nursing, because this is their core from Nightingale on. So I used the word caritas from the Latin word, which brings together the consciousness, an evolved consciousness of caring and love and kindness and something precious that you can't take for granted. It's here and it's gone. It's here and it's gone. And you have to cultivate it. You have to have the knowledge about it. It's not something you can assume. And so as within a disciplinary structure, caring really has a very specific ethic, of this ethic of belonging, that we're all connected in this infinite field. And so what we do to ourselves, we're doing to another. What we're doing to another, we're doing to ourselves. It's that kind of quantum universe reality that we're faced now with the pandemic that's coming to life. And so it's also about the worldview, or the ontology is one of relationships and meaning and purpose and values that have to be sustained. And then that ontology of their being informs their epistemologies. And we have been so quick to adopt empirical knowledge as the only value of knowledge, when we know there's so much more. So that expands our epistemology under a caring science model to honor all ways of knowing and relationships of meaning and so forth. And then that informs our methodologies for research. So it allows us to expand and explore other ways of knowing beyond just an empirical way of knowing. So that opens up all the phenomenology and ethnoscience and lots of other options about how you even bring arts and humanities back into science, an expanded model of science. And then that informs our practice. And so I've been using, in my latest work, it's called Unitary Caring Science, the philosophy and praxis of nursing. And I use the word praxis very intentionally because it's beyond just practice to be practicing. It's informed practice. It's informed by your theories. It is informed by your values. It is informed by your knowledge. It is formed by your worldview, by your ontology. It is formed by this ethic of belonging. And it is informed by your moral foundation. So all of this is expanded. It doesn't take away anything of the lower empirical world, but it elevates it. And I love this work. You probably don't know it, but he wrote many back in the 80s. But Willis Harman was his name, and he was one of the founders of the Institute of Noetic Sciences, which is doing amazing work in these healing models and so forth. And one of the things he wrote about was what he called the downward causation model of science. We go down, down, down to look for smaller and smaller and smaller parts in the particle world, in contrast to an upward causation model of science. So if you can accommodate more and more phenomena as you go up, you have a greater explanatory model. And this is what's happening in the quantum universe, in the worldview of unity, is that you have this other way of accommodating multiple ways of coming up with new explanatory models of science, including how do you explain prayer and distant healing and these phenomena that people are experiencing across time, but we don't have a way to explain it in their Western model of science. So when you elevate your models of science up to this upward causation model of science, he actually said you can get into a spiritual science or sacred science. So anyway, I'm kind of far out here, but this is kind of where I am with the evolution of this work. And so again, the other point I would make is the use of the word caritas. Caritas also brings caring and love together. And so you might say, well, how dare you put love into a model of science? And then I would say, with the phenomena that we deal with all the vicissitudes of human experience and our values and commitment to humanity, how dare we not acknowledge it as part of who we are as their profession?
That's beautiful, and thank you for sharing that. I know that you and I can go into the weeds of philosophy and theory and epistemology and such like that. But for me, as a layman who is not a nurse, not a clinical professional of any sort, when I first read nursing, I read it not expecting to understand anything because I am not a nurse. But as I read into it, and I read it about 3 years after I'm Here came out, and I had just finished grad school, and I expected to read your book because I wanted to read something that all of my audiences were reading. And I got into it and I realized how much of it is exactly aligned with the message that I teach, which is presence. It's that ability to be there for another human being during their time of suffering. And that's the greatest gift we can give another person. I feel like I'm just barely on the surface of that, giving people the practical words of I'm here when you are present for another person witnessing their suffering. And you've taken it to so many different facets and dissected this so well that love has to be a part of the science. And I think that is a lasting, beautiful thing that we are leaving to the profession of nursing and really to all clinical professionals.
Well, it's nursing and beyond nursing because it's about our humanity. And I think that's the cutting edge difference, is that nursing is really about, I put it as nursing has a global covenant. This is not a customer model we're talking about. That when you go to the depth of what this work is really about in terms of caring and healing, nursing in particular has a global covenant with humanity to sustain human caring and healing and health for all in the midst of threats, be that threat biological or otherwise. And I think your focus on I'm here and presence is so important because that's who we are. That's what we offer. We teach who we are. We practice who we are. So it takes some conscious evolution of our humanity, though, to sustain ourselves. And this is one of the biggest crises right now with the pandemic. How do nurses sustain their own self-caring and rise above the fear and all the negativity that's in the media right now and still be there for another person in the midst of all the fear and threats? It's really quite a challenge of a really turning point almost for our world today.
And for nursing, it was a challenge before the pandemic ever started, right? We were already dealing with a nursing shortage. We were dealing with so much exhaustion and compassion fatigue and burnout. How do we take these philosophies and apply them? The nurse, if they're on the floor right now, or they're in the ER, they're working in the ICU. How do we take these philosophies, and how do nurses who are doing the bedside work every day, how do they apply these to their own self-care and their own healing through this extremely traumatic experience of the last 16, 18 months?
Well, and as you say, not just this period of time, but across time, this has been the challenge because the systems we're working in are really not geared toward caring. They're geared toward economics and control and domination and treatment and cure at all costs. So what I think what is happening is really because nurses themselves have wanted a theory to guide them. And I use the word theoria, which is a Latin word, means to see differently, to think differently, to envision things differently. And so nurses are teaching me how they take my work and translate it into very concrete, almost rituals. For example, using hand washing as a moment to cleanse self, not just for infection control, as important as that is, but really as a way to center themselves, to bless and release that last person or situation so they can be more present to the next person, using that as a transition. They're pausing before they enter the patient's room. Some of the hospitals actually put magnets on the patient's door to remind them to pause, to center themselves. And now we're using some of the science of the heart to drop into your heart and bring up feelings of compassion, of gratitude and appreciation, some tenderness, kindness, just for yourself as well as for that person you're going to be seeing when you open that door, and teaching them to not just run in the door and do something to somebody, but really to open that door and pause and read the field, so to speak. So you're energetically paying attention to what's happening in that space and seek to see who is that spirit-filled person behind the disease or the diagnosis or even the behavior you may not like. Who is that spirit-filled person? And using your heart center, not just your head and ego and fear and control, but really pausing enough to be centered and grounded. And using silence, I find, is the most powerful intervention, if you can use that word, of your being present. It's just to be silent and hold that sacred space for the other person to speak and to be heard, to be authentically heard, is so, so important. And more recently, there was this listening project that was done nationally of nurses during this pandemic just last year. And one of the things they found, it was called the Listening Project. They listened to nurses and they wanted to hear what nurses had to say, what they needed during this pandemic. And this is what they heard from the nurses. There were 5 themes from listening. One was hear me, protect me, prepare me, support me, and care for me. And that's what nurses need right now from the systems. And it's not necessarily happening, but if we listen to patients and we listen to nurses, we will be much better off in terms of delivering the kind of care that we're expecting and the public is expecting, as what is fulfilling for nurses to carry out their professional covenant. Every person in the world needs to be heard. Every person in the world needs to be seen, and every person in the world needs to be affirmed that what they have to say matters. So it really, this is my Caritas process number 5, is like listening to another person's story and allowing for expression of positive and negative feelings, because then the person can hear themselves more clearly.
It's amazing what we can hear when we stop talking. It's amazing what we can understand when we stop trying to control conversations and when we let things flow naturally and as you said, set aside that sacred time, that sacred space to be in communion with one another. I'm wondering today, and I understand that right now we're not going to come up with an answer today on how to fix all of these issues across the profession of nursing and the spikes and the surges that we're seeing for the last year. In my circles and my communities with my hundreds and hundreds and hundreds of nurse friends, one thing that I've been hearing lately is an emotion that I don't often hear from nurses. And that emotion is anger. that these days nurses are expressing their frustration and they're expressing their exhaustion. How can we apply these 5 points to helping take care of our colleagues or helping to take care of ourselves? What's the best application to get past some of these emotions that we don't typically think of when we think of a caring, a compassionate environment?
Well, I think the first step is the very first kirtas process is the practice of loving kindness and equanimity and forgiveness and compassion with yourself first. Now, how do we do that? We can do it in the moment, if we have this consciousness, but we have to have our own spiritual commitment for our own spiritual growth and practices. More recently, one of the things I was doing, I was writing, doing a new edition of my book, Caring Science is Sacred Science. And I woke up in the middle of the night and I said to myself, well, what are my practices? Should I share my practices, with others? If I'm talking about caring science is sacred science, how do you sustain the sacredness of our work and for ourselves? So I came up with what I call these 7 sacred sutras. A sutra is kind of an aphorism. It's a short word or phrase that has a higher vibration, kind of spiritual meaning. It's not the word itself, but the word is pointed towards something greater. It's like, I don't know if you know the Buddhist expression where somebody's doing a teaching and they're using their finger to point toward the moon. Like the moon is what they're pointing toward, but we mistake the finger for the moon. Well, it's that kind of analogy. So these 7 sacred sutras that I have been sharing with some of the nurses and the programs that I'm doing, which you will relate to. The first one is just stillness. Just be still. Find your own way to be still. The second one is silence. The third one is solitude. And the fourth one is spirit. Because when you have this stillness, silence, solitude, you can open to spirit and higher vibration, renewal, energy, guidance. And the fifth one is simplicity, is to clear out our minds and clear out space. So you open up space for something new to happen or to elevate your consciousness. And the sixth one is service, as in sacred service. Like I'm here for a reason at this time. We can use this pandemic as a portal to a higher consciousness. Like we're here for a reason and we don't know necessarily why, but we might find out why we're on purpose. And the last one is surrender. Like we don't have all these answers and there's nothing else you can do. You have to surrender to that which is greater than ourselves. So these are simple practices that we might have to do privately, but it's elevating our consciousness. So even to be present, you have to have a certain consciousness to even know how to be present. So all of these are preparing us for our own depth of our humanity and rather helping us to integrate our being, the finest way of being human, with our doing. The finest of the empirical science and technology with the values and with the human dimensions of our world and our reality. We are like the light in the institutional darkness because we bring the light of our humanity. Nobody can substitute for that. No technology can substitute for the human connection.
You're right, because what is life for us if it is not interaction with our fellow human beings, if it is not love and concern and respect and support for our fellow human beings? What are we? We're another species, right? I just love that. Can you tell me how you have witnessed other nurses or clinical professionals putting the 7 sutras into practice?
Well, these are just very recent. It's only been in the last 6 months or so that I've started sharing these. But when I've been doing a series of virtual programs of kind of renewal and just inspiration. I'm doing one right after this with all the nurse leaders at Kaiser Permanente in Northern California. And, they're all hurting. They are angry. They're angry at a system that is kind of, they put up with for a long time. And so all of this is revealing all the interferences with the ability to have human caring and to really violate human dignity in the midst of the way things are being handled with some of these crises, not for them, just for themselves, but for the patients and families, and not being able to see loved ones and so forth. Some of these practices really need to be critiqued because they're based on fear and not just, science. So we use science in a lot of ways to dominate things that interfere with our humanity. But so anyway, the seven sutras are a way to shift from doing to being. How do I take care of myself? And I think the other way that nurses have told me, and they've actually written about this, where they've had a major crisis in their life, a loss or death, and they use these 10 Caritas processes to heal themselves. And this is what's also happening with nurses. We have these programs. One is called the Caritas Coach Educational Program, and they go through the 10 Caritas processes like a station of each one, and they use it for themselves. So then they can intellectually and experientially know what these universals of caring are, and then they can translate it with their colleagues, with patients and families and so forth. So they're actually transforming the self and system inside out in these systems. The one that's most active right now, there are quite a few. If you go to my website, you'll see hospitals that are formally affiliated with me doing this work. They're teaching me. But the one that's doing the most probably advanced work right now is Kaiser Permanente has been doing this for many years with their practice model, but they change when you have leaders that don't have the consciousness. It oppresses it stifles the staff nurses that are doing this beautiful work. So you've got to have a combination of the leaders with the staff. And so we do have a new program called Caritas Leadership Program that we're doing now with Trinity Health, their whole national system. We're training their leaders so that they can actually support the staff. And then the staff go through the Caritas Coach Program. So they have this upside down and down, up and down intersection between the leaders and the staff nurses with a shared consciousness. And systems that are most successful are ones that they have a shared consciousness. They're changing the culture in these small and grand ways from the inside out, from the human changes, not fixing up the environmental field. That's important. But you can have the most beautiful hospital, but if you don't have people in it that have a consciousness of caring and tenderness and love and compassion, then you can actually be destructive to the staff as well as to the patients and families. And that's an awakening in and of itself to realize that.
It's amazing how when I work with hospitals, they know their mission, vision, and values oftentimes, but the culture of the organization is not aligned with those mission, vision, and values. And if there are organizations, if there are hospitals out there that want to receive this type of training, what is the website that you would send them to?
Send them to my website,
okay,
WatsonCareScience.org, WatsonCareScience.org, because there you have a list of all the hospitals that are formally affiliated with me, really systematically implementing this work. And we've got Stanford Health, Stanford Children's, we have St. John's in Detroit, we have I can't even think of them right now. Quite a few of the VA hospitals, the VA in North Carolina, VA in Houston, VA, Kaiser Permanente, Northern California. Trinity Health is a new one. So, there are probably about 15 or 16 hospitals that are systematically committed to doing this. A new one that's emerging is Cedars-Sinai in LA. Another one is in Queens Medical Center in Honolulu. So people are waking up. They really need this. where do they come? They come to this work of consciousness of caring science as a way to really deal with the human dimensions and humanizing the healthcare system when they have this awakening and commitment that goes beyond the medical treatment and the technology and the economics at all cost. And that's the shift that is having to happen, or we won't survive.
Yeah, I don't want to sound bleak, but I think you're right. If we're not doing the work internally and organizationally, we won't be able to survive this onslaught and this change that's come about in the last couple of years. So I'm so glad that you're doing this work and sharing this work with some of the leading hospitals and healthcare organizations around the country. And that really should be a lesson to all hospitals and organizations that no matter how good your culture is, which I don't know any leaders who say our culture is 110% perfect, we want to make no changes, right? Everyone is looking to improve culture and engagement. And you're giving organizations some real hands-on practical programming that is going to get this into the hearts and minds and souls. It's a beautiful thing. And I want to learn. I want to learn more. I've learned so much from you, but I want to learn more.
No, you're kind. Thank you. Well, we're all learning from you as well, Mark. You're a gift to this work in our world because you speak from your own experience as a reminder of that which we know, but we lose our way. And so this remembering to just this presence of our humanity in those moments of crisis, of turning points in a people's life, that's what we never know how we're touching them. But you've reminded us of the importance of how you were touched by this simple, beautiful gesture of a nurse's humanity being present.
I always say it's not rocket science. It's just being human to one another. But so often we lose sight of that. It gets out of our realm of practice. And sometimes we just need to return to the simplest things.
Exactly. But it does make a difference if you have a theory to guide your practice.
Of course.
You have a language and you have an intentionality and you have a consciousness and you have a roadmap to remind you of those practices that we lose our way. So the theory actually provides that evolved consciousness and the language to remind us.
And today you have given all of us such a reminder of our humanity, of how we can be present for one another and ways that we can be present for ourselves in the midst of our own suffering. And we're all suffering, right? It's part of the human condition. We're all suffering.
Absolutely. Absolutely.
Is there anything else you'd like to share? If you had the opportunity to stand on the highest mountain and the world at your feet and would listen to anything that you say, what would you say? What would you like to impart the world with? And I know that you have books and articles and programs, so maybe the question has already been answered. But what would you want to imply to the world?
Well, I believe we are having to wake up as humans to a higher dimension of who we are. That is a spirit-filled human, and we evolve in a higher level of consciousness and spirituality, and not even knowing what that means necessarily, but we cannot survive as humans or the planet with the dominant worldview that is operating right now, because we're killing off humanity, we're killing off the planet. So we have to either evolve to a higher dimension of our reality and finding new ways to be in the world with beyond the fear and the ego and the control and all the domination model that we're experiencing, and really work together with a spirit-filled dimension of our humanity, opening up space for something new to happen, using the human imagination and creativity beyond our usual mindsets. And I think that's what nurses represent. I think the other thing that's happening that other scholars have talked about and researchers and philosophers is that if we truly believe that we're in this quantum universe and everything is connected, then everything we're putting out into that field is affecting the whole. So if we're putting out fear, then that you're accelerating the fear. If we put out higher vibrations of compassion and caring and love, those are higher vibration dimensions of energy. You're affecting that field at a higher level. And I think that's what the invitation is, or the opportunity is, or the challenge is for us to really have our own practices to put higher vibration energy in the field so that we can disseminate and get rid of some of that fear and the lower dimensions that are keeping us locked into this patriarchal kind of world that we've created, which is a domination model.
I love what you said, being open to evolving, being open to change, being open to seeing those things in ourselves that we may not really want to look at, right? The science model doesn't hold up for being. The science model, right? So I'm just so thankful that you have chosen to share your insights, your wisdom, your experience, your research with me, with our listening audience today. And Dr. Watson, I just cannot thank you enough for being here and for being you. Thank you so much.
God bless. Thank you so much.
Thank you.
All the best.
Thank you.